Okay, welcome back. This is Senate Health and Welfare, and it is still February 25th. So we have been looking at some bills related to prescription drug repository program S-243, and Jen is here to talk about it with us. I don't think we've made any changes on this bill, Jen. And
No, you have not.
Yeah, so could we do this, please? Could we take another 10,000 foot look at what's in the bill? And then, as I said offline, we haven't had additional testimony on the bill, mostly just because it hasn't happened, and I take responsibility for that. But I don't know that it would be absolutely necessary, given it's a study. So if we could just look and see what's there, and then we'll make a decision how to proceed.
Sure. Do you want me to put the language up on the screen? Or
Please.
Just talk about it. Okay.
Yeah, let's put it up.
Right. All right. So you should be able to see this as 243.
Yep.
So this is an act relating to implementation of an unused prescription drug repository program. And the overview here is that the Agency of Human Services, in consultation with Board of Pharmacy and Board of Medical Practice, and after making reasonable efforts to consult with representatives from a number of different types of healthcare facilities, is directed to evaluate the feasibility of implementing an unused prescription drug repository program that would accept and dispense donated drugs and supplies to Vermont residents based on eligibility standards to be determined. And it gives them certain things that they should look at in determining the feasibility, like what the potential benefits would be, the costs of implementation and administration, how to fund it, what criteria there should be for healthcare facilities to accept and dispense donated prescription drugs, eligibility criteria for who should get the prescription drugs and supplies, what fees would be allowed to be charged for the drugs when they're dispensed again, or for accepting them, the types of drugs and supplies that would be accepted, and how to do outreach and education to the public about the availability of the program. It would have the agency provide its analysis and recommendations to this committee and others by January 15th, 2023.
Okay, so when it talks about reaching out to other healthcare facilities, that would include Senator Hardy's free clinic.
I think it could. It doesn't specify. It talks about outreach to but certainly, given that you have expressed interest in that, I think you could either follow up again by letting them know specifically that that is of interest, or trust that they have been following the process and would be aware of that.
Yeah. Okay, so committee, here's the bill, and we've had supportive testimony from DOH on it, and the question is, how would you like to proceed on this bill? Go ahead, Senator Hardy. And then I thought I saw Senator Hooker too, but I don't know.
I'm eating my breakfast, so
yeah, that's fine.
If you want to go, Cheryl, while I chew, then I'll go after.
Thank you. Thanks.
Having a great bagel.
So this is a study. This would determine like where the collection point would be. This would determine who would be overseeing this and how they'd be examining drugs. I mean, I'm not. So whatever comes out of this bill would set the parameters for setting up the repository.
Right, they'd be coming back with their analysis of all of these, the pieces that you've asked them to look at, and their recommendations for implementing a program, but it wouldn't actually create the program.
Okay.
Yeah, there will definitely be costs associated with it. So
there will, at a minimum, need to be funding, and you may want to, and it probably would be a good idea to put some of these provisions, particularly around the safety, patient safety, in statute.
Yes. Other questions, Senator Hardy, go ahead.
So I was not in committee the day that you took testimony. I can't remember why, but so I was just looking to see who testified and what they
Not me.
said. It looks like David Englander from Department of Health came in and he presented a study that's already been done. So did this study, I'm just looking at it right now, did it make a recommendation? Do you remember, Jen?
Yes, they did do a study. They were directed to do basically the same study a few years ago. They provided a report. It talked about some of the programs that have been done in other states and estimated the costs. But they have asked to effectively be directed to look at it again and provide an updated report.
Oh, okay, so they want to do an updated report. That's your impression, that they want us to ask them to do a report?
Yes, I believe that is, or at least to look into it. I don't know how strongly they feel about the study, but I mean, the report part, but I think they would like to look into it again with updated information and determine what are the best options for Vermont for such a program.
And do they need resources to do the look into or the study, or did they say they could just do it?
Don't believe they asked for resources to do the report. And I don't know if you want me to see if David Englander is available to hop in.
Why don't we do that? Aaron, do you know if David is available still? I know he was available earlier.
David is watching. I can have him join.
That would be terrific. He is always right there.
Looks like Senator Terenzini has his hand up.
Oh, thank you. Go ahead, Senator Terenzini.
Thank you, Senator Lyons and Hardy. Maybe I can wait for David, but I'm just wondering, and I support the bill. It's not that I don't. It's a fine concept, but why would they even need us to draft this or get involved if it's something they want to do anyway? Just go do it, in my opinion.
Good question.
And I think David would like to be asked that question. So I think he's hopefully on his way in and
Okay.
can answer.
Oh, yep. He just sent me a note. He's here. He must be finding the Zoom.
I just sent it to him.
Okay, good. All right. So, yeah. I think the last report was very expensive, but that's the next person.
Yeah, he's
Yeah,
not here
okay.
yet.
That's not David. All right. I think the Iowa, when we looked at the Iowa program and then they tried to sort it out with the recommendations, it was very expensive, costly, relatively, for our little state.
Expensive to stand up the program.
To do it, to put it together. Yeah. There he is.
Good
Thank
morning.
you for being available to us. We appreciate it.
It's always my pleasure. I do want to note that I appeared before Elcar yesterday, and Senator McDonald asked why I had parking meters behind me.
No comment.
Those are owls.
We got it. The wisdom.
Well,
Okay, so Mr. Englander, thank you for
Yes.
being here. We are looking at S-243, the drug take-back redistribution study that you would be engaged in, and we had some questions about that. So Senator Terenzini, why don't you ask your question first?
Yeah, thanks, Senator Lyons. Good morning, David. I just asked the question before you popped on, why I support this legislation if need be, but why doesn't your department or agency just go and do this? Why do we need this bill?
so good morning. My name is Dave. For the record, my name is David Englander. I'm the Senior Policy and Legal Advisor to the Commissioner of Health. I think I testified previously that the department doesn't, from our perspective, we don't need this bill, that we will go and do this. We don't need resources. It's our intention to pursue this. If there was a bill or not, we're going to do this. I believe Senator Hardy, I promised a sealing wax, and I think you wanted it signed in blood, and I declined because of the sanitary issue.
Yes.
I remember that now. I was here. Okay.
Yes, you were.
Yeah, yeah. Sealing wax is fine, David.
Yeah. So,
So just to follow up to that, then Senator Lyons, if you're all right with it,
No, that's
you know,
fine.
as we're coming up against crossover, and we're then there's a lot of bills to vote on and pass through, and then take over from the House after our break. I mean, should we just shelve this and just, you know, go off of David's word that his department's going to do the good work regardless?
The only question I have about that is it would be important for us to get the information back from the Department of Health, and it is an election year, so there will be people who may not understand that this is something that the legislature would like to see happen. So it's not completely cut and dry. They'll go off and do it. That's fine. I think if we have it on the burner, whether it's front or back burner, for the legislature to review next year, I think that's a good thing. So that's my comment there. And it's not a heavy lift in terms of, it doesn't have an appropriation associated. It's something that people will find useful in the community, and it will perhaps save some money for prescription drugs. So, Senator Hooker.
Thank you. I'm just curious, David, what happened with the last report? Was it the cost that kind of shelved it, or?
So it wasn't shelved. It wasn't shelved so much as we were asked to provide a report, and we provided the report. And it's really that the next steps really need to be taken by the legislature, or, you know, in consultation with the administration. In, is this something we actually want to pursue? So we identified the what we thought was the most straightforward way to pursue a program, and what the costs were. We Department of Health don't have the money to do that. So it's a question of, it's the beginning of the conversation from the health's perspective. And by the way, Madam Chair, I didn't mean to say that there wasn't a need for this bill. I just meant in terms of the health department's intention that we would pursue, updating irrespective. I didn't mean to, I wasn't questioning the merits of the bill. So forgive me if that's what I said. So what there needs to be is a more fulsome discussion of how do we move forward. And before doing that, we just need to have updated numbers and an updated sense of. So if you've read the report, or maybe you recall from the past, that Iowa currently has a program, and our idea was to utilize Iowa's current infrastructure. So we'd want to reach back out to Iowa and say, is this still possible? What are the costs would it be for us? Both money in state as well as money that would be going out of state.
Okay, and so that would be what would come back in the report to the legislature next year if we should pass some legislation requiring that. Right,
and then we would have the real discussion. Okay, let's do this. What is it going to look like? What appropriations will be needed?
Okay. Senator Hardy.
I'm with Josh, our Senator Terenzini. If we don't need to do this bill, we got a lot of other bills that we need to do. It sounds like David is going to sign with Sealing Wax that he's going to do this. I mean, we could send them a letter and just say, we're excited you're going to do this. Please do this and let us know what the results are. And if you need, come back with an appropriation request next year or whatever. If you want to do that, I think people don't want us wasting our time on things that are not necessary in an election year. So, or any year.
Well, I know. Yeah. Okay. Thank you. Senator Cummings, comment?
No, I remember when we did this the first time.
Yeah.
So if they can go forward, that's good.
Okay. Okay. I'm kind of ambivalent. The bill itself, we could pass out today and done out, over and out. It's a message to Department of Health, and it's a message to our colleagues that this is something that should happen. But if the bill doesn't go any further than that, that's not a good thing. All right, so let's put this bill on the back burner and turn the burner off, and then we may or may not come back to it the week after town meeting, because it sounds like it sounds like there's not an interest in moving the bill based on the testimony that we've heard. I'm trying to reflect what I've heard.
Well,
I personally would like to move the bill, but I'm not passionate. So go ahead, Senator Hooker, and then Senator Terenzini.
Senator Hardy suggested a letter. In a letter, could
yeah.
we request a report? I mean, I don't know, is it okay to ask for a report?
An update on the information
Sure,
related
sure,
to that?
without
Yep,
going through the
can do
whole
that.
process.
Sure, we could do that. That's a good idea. Senator Terenzini?
Just following up on your comments, Senator Lyons, I mean, I'd make a motion now to pass it if we felt like we wanted to. I'm just, it doesn't matter to me either way. And if you're passionate about it and you
Oh, I'm not.
want to see it go, I'll make a motion. But it seems like they're going to do the work anyway. So that was my point. So.
Okay, let's do the letter. Does everybody think the letter is a good idea? We're getting good at letters. Okay.
A letter about diapers, a letter about drugs. We're good.
May as well, top to bottom, top to bottom. Okay, David, does that will serve a purpose?
Absolutely.
Okay, and if you don't mind helping Jen craft the appropriate language so that we're getting back the information that you're going to be identifying, that would be helpful in getting this program up and going.
Perfect.
All right, terrific. Thank you. That's great. Thanks for coming in.
Of course.
All right. Okay, so we have two people in the waiting room to give us testimony on 197. So Aaron, why don't you bring those two in, and then Jen will step into S242 when they're finished. So, and just to let the committee know, I had a discussion and conversation with the Department of Mental Health yesterday, and they have sent some information in on S197, and I've asked them for some language that would improve the bill in terms of simplifying the grant process and the role of AOE versus DMH. So we will be seeing additional information on that. And as I think you remember, Laurel Ormond was the person who spoke with us earlier about the bill as well as Emily Haas. All right, welcome to our two folks. Lance Mateer is here from Northwest Counseling Support Services, and also Anne, you're here, Anne Paradiso. Thanks for being here. So Lance, why don't you go first? We have about 15 minutes total for your testimony from both of you, and we look forward to hearing it. And have you sent something in? So Lance, have you sent a written testimony in?
I have not, but I can do that.
That would be great.
After our time together today, absolutely. And Anne, I think Anne was going to provide a bit of an overview of our system. So if it's okay.
No, that's perfect. We like coordination.
We tried our best. Thank you.
And please introduce yourself for the record, and we look forward to your testimony.
Sure. I'll get started first and then turn it over to Lance. Thank you for having us. My name is Anne Paradiso. I am the Director of School Programs at Howard Center. I wanted to share a little bit about the DA system and our history with school mental health services. We have been in this business for nearly 30 years. It's hard to believe the length of time that we've been able to provide these and develop these supports and services. And the success of this model has relied on strong partnerships with schools and districts. While many are aware of the school-based clinician services, a number of designated agencies also provide one-to-one student services in specialized schools. So our system has a really well-developed expertise and skill set to effectively provide supports and interventions to children and youth experiencing emotional behavior challenges. We've accomplished this through provision of direct student services, as I've just referenced, but also a lot of team and school consultation and targeted training. Our Our partnership supporting children's mental health extends into the community, and in many counties, DAs are working with childcare programs providing early intervention and prevention. To highlight one specific relationship in Chittenden County, Howard Center is working with the Sarah Holbrook Center to provide mental health consultation and training for Burlington children and youth who receive their after-school vacation and preschool services. So with adequate funding, we're well equipped to contract with partners to bring needed mental health services and supports into the community, and really encourage the committee to consider the existing system of care and the successful models that we've developed over the years. So that was the overview I wanted to give, and then I think Lance is going to get a little bit into more of the specifics of the service delivery. Thank you.
All right.
Thank you.
Again. And thank you just for the opportunity to be here as well. I think this discussion is incredibly important. So my name is Lance Matera. I'm the team leader of school-based clinical services at Northwestern Counseling. And there we have a team of 14 master's level clinicians who provide support to over 400 students in Franklin and Grand Isle counties. I wanted to talk a little bit more about the role of a school-based clinician and about the services that they provide daily in an ongoing way to the schools that they're embedded in. First of all, I just want to take a moment to highlight the importance of school-based clinicians, because they're different than just a mental health, I don't want to say just a mental health provider, but they're different than a private mental health provider in the school. They really are embedded within the fabric of the school. They're a part of the school community. A lot of the clinicians on my team have been working in their schools for the past 10 years. So the connections that we build to the community and the relationships that we build with our schools are incredibly powerful. And it's really the basis of the effectiveness of our work. So the role of a school-based clinician is to provide individual therapy, care coordination with families, pediatricians, and medical providers, with DCF, and then just any other people who are involved in the lives of young people. School-based clinicians provide mental health consultation to school staff, crisis evaluation, not only for our clients, but also for the general population, student population. When a young person is struggling, they can come to our school-based clinicians to receive a crisis evaluation and direct support in that moment. So in addition to that, we also provide general population, we would call them community level supports to the entire student population. So some of those things include groups, individual check-ins when non-client students are struggling. And we also provide regulation breaks, and then also coaching and classroom push-in. So we're not only supporting the students, but we're also supporting school staff as well. And this has definitely been a shift for us, or something that our team has moved into more within the last 2 years over COVID. So we have noticed some really big gaps in school resources. And educators and school staff are needing different things from us. So we've really shifted a lot more of our time to be focused on providing consultation, coaching within the classroom, providing trainings as well around social emotional learning, and really just best practices to create trauma-informed classrooms. So that's a shift. We are working to lean more into that. It's really serving to fill some of the gaps that we're noticing, and some of the increased needs of students as well. So we're seeing that the students who have underlying mental health conditions are far more acute. They're struggling so much more than they were 2 years ago. We're also noticing these struggles just across the general student population. We recently completed a time study in January. So this was for all school-based clinicians throughout the state participated in this time study. And what we found for 1 week in January, it was just a random week, but we found that we were spending over 8 hours a week providing just that general consultation, training, classroom push-in, and support directly to educators and school staff. So we're doing a lot of this within school, and I hope that we can increase and get more creative around the supports that we're providing to schools. So I think the reason why you had us here is to really answer or maybe to help you answer the question, or to give you some perspective on how do we best support students. So I see this as the dilemma, right? Do we create new systems to support our youth, or do we invest in the infrastructure that's existed for decades, right? There's a lot of experience and a lot of connection and a relationship that's already been built in our community. And you know, the designated mental health agency services are really embedded, they're interwoven into the fabric of our schools and of our communities. And to help you all to answer this question, I'll refer back to testimony actually from Superintendent Lynn Coda in my area where I live and work. She said, the best way to support Vermont schools with mental health is to support the systems schools rely on to support children and families in crisis. If we can work to ensure that families have access to necessary resources to meet their basic human needs, fewer students will require more intensive interventions. Specifically, Lynn was talking about and recommending providing this support to Vermont's designated mental health agency system. So I'm grateful that you all are having this conversation, and we have resources to provide to students. However, we're providing that to schools and students. They're in desperate need right now. I would encourage us to definitely look at the resources and systems and infrastructure that we have in place, and see how can we work to sustain that and also expand that as well. There's a lot of knowledge and just a lot of resource there that I feel can benefit so many more students.
Thank you. This is very helpful. And so in my conversation yesterday with the Commissioner of Mental Health, we talked about increasing the flexibility within the bill so that it would allow for you who are associated with Vermont Care Partners and the DAs to be have greater involvement. The issue also is that we're seeing tiered needs. And so some of those needs obviously are being met through the Masters of Mental Health and the folks that you've been talking about. And some of those needs might be at a level that require don't require a master's level trained psychotherapist. So therein lies kind of and we've heard that there are just needs across the state. I guess my question, as you looked at your January study, did you identify that all the needs are being met across the state?
So that the 8.6 hours a week is your, sorry, just to clarify.
Are there sufficient resources right now to cover all the needs for kids?
No, I mean, this is about, sorry.
Yeah, no.
But I would say no.
A silly question, I think.
Well, this is clinicians balancing a caseload and then working to meet the ongoing needs that schools are having.
Yeah,
for sure.
It's a conundrum. So we want to be sure that we're covering the variety of needs from, I will call it lower level tier to the higher level, master's level tier, and ensuring that maybe we'll have to evaluate what we have in that bill, and we'll be working with the Agency of Education and the Education Committee as well to ensure that the services that we can cover a multitude of services through the grants process. I'm not hearing that having additional resources is a bad thing, but it's how accessible they are to you who are currently doing such excellent work in the community.
Yeah, and I'd like to add that while there certainly are targeted interventions that our school services across the board provide, there also is, school community supports that the clinicians offer to students that are in a lower tier. And then certainly in our contracted partnerships, I referenced Sarah Holbrook, there are many others. That isn't about like the highest level intervention. That's not a tier 3 intervention. That really is around helping to equip staff with the knowledge and skill set to be working with those students that are present in, whether it's after school or vacation services, that are presenting with behaviors that exceed the training and knowledge that they have. So we bring in that specialized information, share it with them, consult, give feedback, train, and then they're better equipped to manage those kids that still have needs but don't need to be in the one-to-one intensive mental health service or support.
We've been talking a lot in this committee about certification for support staff. So it sounds like it's that kind of training for people to be more engaged.
Yeah, it doesn't result in a certification, but it certainly expands their knowledge of trauma-informed interventions, behavioral supports that are effective, and I think it better equips them to work with students in a variety of needs.
Okay, thank you. Senator Cummings. Senator Cummings, you are muted.
Just getting hit in my drawer. Tying it all together, though, your first well, I know my local mental health agency is having trouble hiring master's level because of the wages they're able to afford. And I'm assuming Northwest isn't in any better financial shape. And I think I heard you say that if we have extra money, that you have the systems in place, that you already are working with after school programs with school staff, and that if there's extra money, you could put it to good use. Is that, I think that's what I heard.
It is true. We are in unprecedented times, and everybody is experiencing workforce shortage. So we can't deny that. There are no guarantees next month. We are looking forward to the day when we move out of this. As you all are aware, the DA system has requested a 10% increase for this upcoming year to help move the wages and get more people able to consider working for designated agencies, seeing that as a viable, place to provide services and earn a living. So it is correct. At the moment, there are extreme workforce shortages. That has not gone away, but we are prepared as that starts to lift to take that expertise in the system we have and bring that into the community. But funding certainly is a part of it.
Okay. Questions for the folks? Senator Hardy.
Thank you, Madam Chair. And thanks, Ann and Lance, for being here and for all of your work. I know personally how important school-based clinicians are. Sorry. I'm just curious, your work during the summer, do the school-based clinicians continue their work in connection with students and potentially staff during the summer? Either one of you.
Sorry.
No.
If you want to talk a little bit more about a statewide or correct me as well, feel free to jump in. So I think that depends on the agency and the way that their contracts are built with the school. So I can only speak specifically for NCSS and what we do. And yes, we do continue to work about 20 to 25 days over the summer. And a lot of that work actually over the last 2 years has shifted to supporting some of the summer programming, because schools had an incredibly difficult time over the last 2 years having educators and support staff come back, very understandably, because they work so incredibly hard during the school year. And that's where we've used school-based clinicians to fill in some of that support. Yes, it is providing a very skilled person. It's a master's level person doing that, but I think the benefit of that is that they can provide so much more to that programming. It's such a valuable resource.
And sorry, go ahead, Ann.
I'm sorry, I was just going to reinforce what Lance was saying, that I do think it varies across the state, how the programs, it's part of the beauty of the system is we kind of respond to what the need is. I know in Chittenden County, our school-based clinicians, the majority do not work over the summer. A few do, but the majority don't. But I'll remind you, our school programs are just like one faction of our children's services. And so there's like family and community support services that have one-to-one staff that provide respite and living skills support throughout the summer, family engagement. So, we work in tandem, that if children's mental health is children's mental health. And so some are housed in schools and some are housed in the community and some are housed in homes. So there's an array of providers available that may step up in the summer and cover for, meeting the support needs of students during their summer break.
Okay. And do you may not have the statewide, but staffing shortages aside, I know that's a real thing, but do you know how many schools do or don't have school-based clinicians? What percentage of schools have them? Do you know in the state? You're not.
We do have that information as a system of care, and I can, just listening to Senator Lyons requesting that we submit a written statement at that time, I could pass that information to the committee for you to have that for consideration.
That would be great.
That would be helpful.
Yeah, I mean, it's such an important service, and not all of our schools have access to it, I'm sure. And if we have money, I'd like to be able to beef up the program around the state rather than start something new.
And there is consideration underway right now about how and you probably are aware, the more equitable distribution. And I think it's really been based on individual schools and districts over the years and who's decided to step up and partner. And so that consideration is underway.
Great. Thank you. Thank you both.
Senator Cummings and then Senator Hooker.
Yeah. The other thing that we don't know, because this bill calls for summer programs, and I'll probably look to Lance. I know Washington County, to the best, I think there is some program in the Barry Rec Center, and Montpelier's Rec Center runs a summer camp. My grandsons from Barry come to Montpelier. I don't know of any other summer program. So are there summer programs up near you that keep kids off the streets, or, how extensive is that coverage?
Yeah, so I can only speak for our area in Franklin and Grand Isle, but there definitely is summer programming available to young people, either through the schools or through local rec departments as well. So school-based clinicians historically have supported the summer programming that's embedded within the school, or what the programming that the school provides, but both could be options for young people.
Okay.
So, and I think,
are they free, or is there's a pretty hefty charge for Montpelier?
I can't answer that really accurately.
I think most are not free because they've got
I
to, be paying their staff or whatever. And it all depends on where you sit on the economic ladder as to whether that's something you can or cannot afford.
Right.
And I think there's a real range, and there's definitely a need there. I mean, I think the difference is we are mental health providers, and our funding is to be delivering mental health services. And so, there's capacity to bolster that within the summer programs, but that's more got of a recreational aspect. So that would vary as far as what involvement the designated agencies have.
so what I'm going to suggest is that we did hear from the after school folks, and they did provide some of the answers to the questions that are being asked. And we are very pleased to have your input on this, because it'll help us restructure the bill in a way that is more inclusive of you and continue the system that you have. But it also provides for additional funding that is so key for out of school activities. So and if right now there's a minimal, a drop in the bucket in the bill. If, as we work through the education committee, we can add resources that will allow for you to have additional money, and it will also allow for after school to expand geographically, all of which is good stuff. So we do want to get it right, and we do appreciate your coming in and clarifying the work that you do. Well, thank you very much.
Yes, thank you. And I know time is limited today, but if there's a point where you'd like to have any of us back to hear about the breadth and array of school services that are provided through the designated agencies, we
will, we'll try to reach out. I've got some recommendations coming in from the Department of Mental Health. The Agency of Education will have its comments, and we'll try to sort this out and use your expertise as well. So this is very helpful. Thank you.
Thank you so much.
Senator Hooker, quickly.
Just before you go, Ann, you've mentioned after-school programs a couple of times, and I'm just curious to know if the school-based clinician is on staff for the after-school programs as well as the regular day of the regular school day.
As Lance has mentioned, this is different across the state. In Chittenden County, our clinicians, their predominant services are during the school day, but there is a lot of care coordination. So if there's students with special emotional behavioral needs heading into an after-school program, they would be coordinating with the providers of the after-school program to make sure that they understand the breadth of needs of a particular student and potential behavior intervention plan or crisis plan. So it's more about kind of an informed handoff, and then a back and forth communication about what may or may not be working. But again, it could be handled differently in different parts of the state. But for Chittenden County, that's how it's handled.
Okay. Thank you. This is great. Thanks for coming in.
Thank you.
All right. So committee, yeah, that was great. That was good. Very helpful. I did want to look through one bill on prescription drugs, but it's got 5 minutes to do that before we take a little break before floor time. Jen is here. What I'm going to suggest is you don't, reading through S242 is an interesting, it's kind of going through the, what do you call those mazes that we see? But the S242 is actually a bill that will help reduce healthcare costs. Right now, what insurers are doing is that they're sending prescription drugs from specialty pharmacists to healthcare organizations. That's called white bagging. So when an insurer has the prescription sent from the specialty pharmacy directly to the healthcare organization. Sometimes insurers are having the drugs sent to patient homes, and then that's called brown bagging. So then the patient carries it in to the clinic where it's used. So what the bill is about is intending to address patient safety issues when the medication is not provided in time for a procedure or is the wrong dosage, because you just don't know. The bill does not affect prescription drugs by mail, but it is about supply chain integrity issues. So just to make sure that when someone gets a prescription, that's stored properly and it's taken and delivered properly. That's what the bill is about. Jen, can you elaborate? You want to elaborate any more on that?
Sure. I mean, I think it's kind of described in very high level in the statement of purpose, but the bill would establish the conditions under which a health insurer, so it would prohibit a health insurer from requiring the medications to be dispensed either directly to the healthcare provider or to the patient to bring to the provider's office. But it would allow insurers to enter into contracts that would, or enter into agreements with healthcare professionals where these activities could occur. And then it would set out the conditions as far as some of the supply chain issues and availability of same day prescription filling and making pharmacists available for consultation, things like that. So it would set out the parameters by which these arrangements could occur, but it would prohibit them from being insurer driven alone.
So that's the bill. I'm thinking, obviously, I know what our time looks like when we get back. So I don't know that we're going to be able to cover the ground on this one. However, it seems to me an important patient protection issue, keeping their pharmaceuticals safe, supply chain covered. So I'm going to suggest that, if you have a minute, you can read through the bill briefly, and then we'll come back and we can decide to work on this bill as we get other bills from the House. We might be able to append it onto something else. And there's another prescription drug bill that has come to us from work of a prescription drug subcommittee from the Green Mountain Care Board. And I think that's 193. It's 193. And that we might want to look at those. And I thought the white bag, brown bag bill would be an easier lift if we had time. I'm not feeling enthusiastic about the time situation. I don't think we've got a lot. So, but just think about it, please, because it is important. So, and then we'll have Jen. I know you've been here with us all morning, but we could have you go through the bill at some point. I can't promise when, but we'll do that. Does that sound like a plan that's non-plan? We'll look at it. We'll either decide we can do something with alacrity, or we will save it to save these bills for work when we get a related bill from the House.
Yeah, 242 seems complicated.
I
just
know, that's why I said
going
don't read
through
it.
So, I don't know. I wouldn't want to rush it. And then the other
Yeah, no, we don't want to
the
make
other
a
one is
mistake.
just a report, right?
193.
Yeah,
Yeah.
it's several reports.
Several
Or
reports.
From the different relevant parties.
We can write another letter.
That one, there might be something in there we could pick up, but I would like to have the group come in at some point, whether it's the week after we're back or after that, because they worked really hard on those recommendations that are in there. Oh, okay.